opinion only, that it's an oral and maxillofacial surgeon's responsibility, and that's where I send all our patients, and Mr. Spencer looks after them for us in our same facility, so you still get your teeth within the same time frame, but he's able to do them, and if there's any problems, it's an area only he can deal with. So your health, your care is our primary importance. So what about home care? It begins and ends with you. Really, that's where it is. We give you one of these machines that my lovely Rochelle, who you'll meet, is holding. It's the Karcher for the mouth. It's a water machine that blasts out water through the mouth, and it actually helps to clean. There's a special dental floss that we give to you, and that dental floss we show you how to use that. So it's really important. And again, why do I need the set of teeth? I keep pushing this because you need the 2 sets of teeth, because you want to make sure you've trialed the first set to get the second set right. So let's look at a few cell transformations. And this is an upper and lower all on 4. And you see the girl previously had a denture on the top and she had just 3 lower teeth. Well, you look at the transformation and she can take white teeth because she's young. It would look a bit silly in me because I'm old, so it wouldn't be quite the right look. And yet we look at this gentleman and he has teeth obviously that harmonize in with his face. So you look on the left-hand side and you think, how can people get like that? And really, I see many people like that, and they're embarrassed about it, and it's difficult, and it actually impinges on your lifestyle, your ability to eat, your confidence, and people become quite reclusive. And so it's just a wonderful experience for me to be able to make that transformation. And the hardest part for people is to come in and sit in front of us and say, hey, I'm here, let's do it. And once we get over that and you meet the staff, then you're on your journey to go ahead. It's a bit unfortunate at the moment. We all have to wear masks, so you can't tell whether you've got bad teeth on the left or teeth on the right. But this is where the journey we're going to take you again. And I had a lovely video, which I didn't show you about this. It made amazing transformation. So people get into these situations and it's not always their fault, but we're there to help you through it. So again, upper and lower cases. Can I just reiterate, if you look at the photo on the left-hand side, you'll see the gaps between the teeth. Gaps between the teeth, if you get your teeth moving and the gaps opened up, it means you've got gum disease. Now, gum disease, please, is a treatable disease. If you have that in the early stages and you get to your dentist and then you get referred to a periodontist, which is a specialist dentist on gums, you may be able to save your teeth and not end up with an all-on-4. So it's really important. When you get to all-on-4, that means you've got to the point where the bone around the teeth has disappeared to the point that I then can't save the teeth. So, you know, in all things we do in dentistry, in all things we do in life, I guess, prevention is always the best thing that we do. And again, this is, I think, I always say, the eyes are always the thing that tell me the joy of people. The lovely lady on the right-hand side hasn't got an all-on-4. That happens to be one of my lovely dentists, Lauren Fowler. She just happens to have that beautiful smile. But I think the joy in both their faces of what we can do for patients speaks for themselves. And let me just let this lady tell you a little bit about her experience.
My teeth were really badly decayed and I was missing quite a few teeth. I lost a lot of them through the pregnancy. And I heard about Bond Street. I came. My girlfriend's had good success. And now I am able to smile again.
So that gives you, I think, an overview of really where we go. So I'm just going to stop sharing my screen here so that I can come up here. Okay, so let me just go through and let me just give you a really good overview of where we're going. And it's important because all-on-4 is something that is a great success for you if you're a candidate for it. So the all-on-4 teeth, which I've got here, is You have 4 implants in each jaw. You have a set of teeth which are screwed on to the implants, and there's 4 access holes. It's a procedure where the teeth, and I'll put them in a procedure so a way you can see, we can unscrew the teeth just with a mini screwdriver. You can't do this. Obviously, I can do this. And this is what we do once a year. We unscrew your teeth to take off, and you'll see you have 2 sets. You have the initial set of teeth, all plastic. If I pop that down and show you, the important part when I look here is look at the implants, is the implants are in the bone, and on top there's a little thing called an abutment. That's a little connector that goes on. And once a year, I always make sure I put my little torque wrench onto there to make sure you haven't got a screw loose. It's very important. A lot of people say they have got a screw loose, but it's not that sort of screw loose. So then we're able to tighten the teeth up, the 4 screws, and then I rush off to Bunnings. Yes, Bunnings, and I get the white Teflon tape that plumbers use, fill the holes because it's impervious to moisture, and I actually fill those holes and seal them off so you can't get any food there. When you look at the teeth, you can see the join between the teeth and your own bone and gum. Here it's just clear because we want to show you the implants, but that join doesn't allow food to get in, but that's the join that you actually have to clean meticulously. Now, when you do the surgery, if you don't do the surgery correctly and you don't have that join up under the lip, it's a disaster because you'll see that every time you smile. And the importance about doing this is doing the surgery in the way it was instructed to be, to make sure that it's 2 flat surfaces against each other. Very, very important. The second thing is that you're going to get this titanium bar, okay? So the titanium bar made by Noble Biocare. You don't want a third-party bar. That's like going and getting a third-party part that you're going to put onto your Mercedes Benz. You need the original part. So the journey is going to be this. You've done the first part tonight by logging on, by listening and understanding what All on 4 is. We're going to then come in and we're going to listen to you and see what your needs are. Then if you decide you actually want to proceed and have an x-ray, and there's reasons to have it, we'll take the x-ray and we can come up with a treatment plan for you. And I can tell you we're going to give you basically a treatment plan of doing nothing, because we're obliged to do that, to inform you of if we do nothing, through to the simple to the most complicated. What you'll be required to do, and it's whether you see me or anybody, is you'll need to sign a form, an informed consent. That means I've told you and you understand about what all the risks are, what the complications are. Then we're going to look at your medical history, because the medical history can actually affect the success rate. So if we know the success rate ranges from 95 to 98%, what can actually affect the success rate? And there's some medical things that can actually affect the success rate. It can be that you're a smoker, and it's absolutely documented that smoking can affect dental implants. So we encourage you to stop smoking. Not easy, we understand it's not easy, but we encourage you to at least try. And if you don't want to give up smoking, you understand that the risk of an implant failing is higher than if you were a non-smoker. Then there's a patient also who's the diabetic patient. And diabetes is a condition that, if not well managed, you can actually affect healing. So it's incredibly important, if you are diabetic, that you look after yourself, or your doctor, your GP, your endocrinologist is looking after you to make sure your diabetes is controlled. Because if it's controlled, then you're like a normal patient to us. And then there's the group that have got osteoporosis. And this is it's becoming more and more prevalent in the community. Osteoporosis is where the bone actually gets soft. And medicine has come up with these wonderful drugs to harden the bone. The effect of how they work and do that is they work by slowing down the bone activity. That means they affect healing. So there are some bisphosphonate drugs that can actually be a real problem. That means if a dentist even took your tooth out, when you're on one of those drugs, the hole in the jaw may never heal. It's a big, big problem. So make sure whoever you see goes into your medical in great detail, because there are solutions that we've got for people that are on those osteoporotic drugs. We need to know that you're going to get through the operation well. We need to know if you're on blood thinners. We need to know if you've had your thyroid removed. There's a lot of things can happen, but we're very experienced in taking you through that journey. We're going to do it either with you asleep, we're going to do it with you awake, depending on which way you prefer to go. Australians generally prefer to go to sleep. In Portugal, they don't give them that option, they just stay awake. But most of my patients prefer to be asleep. We're going to deliver the first set of teeth, the training wheels. We're going to do that on the day or within 24 hours. You're going to get used to those. We're going to see you 2 weeks, 1 month, 2 months, 3 months. We're going to make your final teeth with the titanium bar. Once we've delivered that, you're then going to be involved in the process of doing the hygiene. And that's really important, because if you're not going to do that, please don't proceed, don't waste your money. It is just, it can fail. And, you know, we've been doing this since 1995, Professor Malo has, and the success rate he documents is 95 to 98% over 20 years. So if it was a disaster, you get thousands of implants failing. So it works, it's got research, but you have to look after it. So today has been a good thing for you, because you've understood what All on 4 is all about. And from here, you can decide where your journey takes you. And by getting a treatment plan with the costings, you're then able to look and see what the costings are going to be. And then you're going to say, is this the appropriate thing for me? Am I able to get these teeth done? So that's important. Okay, so that's a lot of questions that have actually coming through, and I really enjoy these questions coming through. And it's important, and I'll go through them, and at any stage, if you like to answer more, I'll go through them now. And if you decide, yes, you'd like to come and see us, then it'd be a great pleasure to see you. You just need to call the clinic, and we'd be happy to give you a free consultation, so that'd be great. So there's a first question, should I get my implants done in Thailand? Well, I think I've basically covered that. I think tourism, in terms of dentistry, in terms of all things now, you can just see what happens with coronavirus. What happens is there's just no option to do that anymore. And the problem is, if you have a problem, you know, and I get patients come in, and you ask my staff, I get them from Thailand, from India, from Vietnam, I get them from all over the world that come in, where people have gone and they've sought treatment that's cheaper. And then what's happened, it's backfired on them because they've got a problem. So and the next question is why do the teeth break down without maintenance? It's not the teeth that break down, it's the implant. So what you can do is you can get a thing called peri-implantitis. Peri-implantitis is basically irritation or infection around the implant, because the implant is not being cleaned properly. So that's really important. So the 27,000, as someone asked, is that the full set of teeth or half? 27,000 is per jaw. So if you've got one jaw, it's $27,000. If you do 2 jaws, it's $54,000. I hope that clarifies that. Another question is saying that unless I have dentures, I can't have All on 4. No, I'm not saying that at all. If you have all of your own teeth, and your own teeth are completely loose and you've got severe gum disease, then all on four is wonderful, because sometimes what happens is people go and have their teeth out and they